I'm Eileen Nutzel, and I'm a dentist at Ashland Dental and Wellness Center. Our office is a complete health office. We not only deal with the oral, but we also deal with the whole systemic system because we believe the mouth is the gateway to the rest of your body. We use PerioProtect tray on everyone. We are proactive instead of reactive, so if your gums are healthy, let's maintain that health. If you have signs of disease, then let's use the PerioProtect trays and regress that disease, allowing for the body to be able to heal itself as naturally as possible with the hydrogen peroxide gel that's in the PerioProtect trays.
I always say the best amount of restorative dentistry is the least amount that we do on our patients. And all too often we treat end-stage disease with patients. The body succumbs to decay. The hard tissues succumb to decay. That's a biofilm disease driven by diet and genetics. We do believe there's a better way. So not only can that PerioProtect get rid of inflammation, it can change the biofilm in nature to an oxygen-loving, aerobic biofilm. It's not going to be a disease-causing biofilm. It'll be communal to your body. And so it also shuts down decay too, because that's a biofilm disease. So this isn't just inflammation and periodontal disease, gingivitis, it's also tooth decay.
Our patients love them. They don't have to see us as often as possible. Their cleanings are atraumatic. We don't really have to use that jackhammer, as they call it, in order to clean off the tartar that's just tenacious and stuck between their teeth or below the gum line. Now it's a simple flick of a little hand instrument most of the time, and the tartar just pops off.
I had a gentleman who had some teeth down in the front here that he was going to lose. I was mentioning to him, I don't want this to happen to other teeth because this is a warning of what's going to happen elsewhere in the dentition. So if this is possible, it's going to show up in various locations. Let's stop it. And so we put him on tray therapy. This gentleman had pocketing. Pocketing's a measurement of health around teeth. It should be 3 or less. He had almost 10 millimeters. And he mentioned to me, Doc, that tooth feels stable. It feels tight again. He mentioned it to my hygienist, and so she took a digital radiograph, and I almost fell out of my chair. She pulled up the x-rays, and his bone grew back about 40% in only 8 months. We didn't splint his teeth. We didn't do occlusal adjustments. We didn't do anything else. All he had was the trays being utilized twice a day for 15 minutes. And these kind of results showed up for him, so it's been phenomenal. Nothing has been as effective as PerioProtect in terms of driving results and eliminating inflammation for our patients.
We have patients being referred to us just because we do PerioProtect. Their last dentist said their gum disease was hopeless, or they got tired of doing deep cleanings every year and a half. And they heard from a friend how well PerioProtect worked for them, and they said, try it. Go see my dentist, see what they can do for you. And we've had patients then become longtime patients because of the tray therapy.